What is the effect of diabetes on the body? Diabetes affects almost all systems, organs, and parts of the body, including the heart and blood vessels, brain, nerves, kidneys, and skin. Sensory functions such as vision, hearing, and touch are also negatively affected by this condition. In the following sections, we will examine the effects of diabetes on different parts of the body. Effect of diabetes on the heart and blood vessels. According to the American Diabetes Association, 2 out of 3 diabetic patients die from heart disease or stroke. Poor blood sugar control in diabetic individuals leads to hardening of the arteries, atherosclerosis, increased blood pressure, and narrowing of the coronary arteries that supply the heart. Initially, this narrowing can cause chest pain, angina, and limit the patient's physical activity. However, if coronary artery narrowing progresses, the effect of diabetes on the heart can lead to severe blockage of the coronary arteries, cutting off blood supply to the parts of the heart these arteries serve, resulting in a heart attack, myocardial infarction. Blood vessels supplying the arms and legs are also vulnerable to diabetes, as high blood sugar damages these vessels, leading to impaired blood circulation. This impairment increases the risk of infections in the hands and feet and delays wound healing. Effect of diabetes on the brain. Uncontrolled diabetes has detrimental effects on the brain's blood vessels. Hardening of cerebral arteries can lead to narrowing of these vessels and eventually to the blockage of small arteries. When a cerebral artery becomes blocked, it causes an ischemic stroke, depriving the cells in that part of the brain of adequate blood supply and leading to cell death, which is one of the most significant effects of diabetes on the brain. Brain cell death can result in major issues such as speech difficulties, problems swallowing, and motor impairments. A severe stroke may even lead to a coma or death. High blood pressure and narrowed cerebral arteries in diabetic patients can cause a hemorrhagic stroke, which is more dangerous and can lead to rapid death. Additionally, some studies suggest that type 2 diabetes may increase the risk of developing Alzheimer's disease. Effect of diabetes on the nervous system. One of the long-term complications of diabetes is diabetic neuropathy. High blood sugar levels damage the walls of small blood vessels and capillaries at the ends of the hands and feet. Damage to these vessels disrupts blood supply to the nerves in these limbs, especially the fingertips. As a result, the individual may experience numbness, burning, tingling, or a prickling sensation in the fingertips, which may gradually spread to higher areas. In severe cases, the person may completely lose the sense of touch in the feet or hands. Loss of sensation increases the risk of injury to these areas, especially the feet. Other effects of diabetes on the nervous system include depression and anxiety, which may be linked to high blood sugar levels. Effect of diabetes on the kidneys. High blood sugar increases the workload on the kidneys' filtering units, nephrons, increasing the permeability of the capillaries and their intricate filtering system, resulting in the leakage of significant amounts of sugar into the kidney tubules. Long-term damage to these kidney capillaries causes the loss of proteins and even blood cells from the bloodstream, leading to permanent damage to the kidney's filtering system. Diabetic nephropathy gradually reduces kidney function, potentially leading to kidney failure and the need for dialysis or even a kidney transplant. Effect of diabetes on vision and hearing. Diabetes damages the blood vessels of the retina, a condition known as diabetic retinopathy, which is one of the most significant complications of uncontrolled diabetes. Over time, this damage can lead to reduced vision or even blindness. Diabetes also increases the risk of other eye conditions, such as cataracts and glaucoma. Hearing loss is also more common in individuals with diabetes compared to others. The effect of diabetes on skin and hair. The effects of high blood sugar on the skin and hair are also significant. Diabetes weakens blood circulation in the skin's capillaries, increasing the risk of bacterial and fungal infections. Poor subcutaneous blood flow hinders the body's immune system from effectively fighting these infections and slows down the healing process. If a diabetic person's skin is injured, the wound may not heal easily. A common issue, and a direct effect of diabetes on the skin, is diabetic foot ulcers, which occur due to slow-healing wounds in the feet, often requiring antibiotics to treat. If the wound doesn't heal, tissue necrosis may occur, potentially leading to the amputation of toes or feet, which is a disabling complication of diabetes. gastrointestinal and sexual complications of diabetes. Over time, diabetes can damage the nerves in the digestive system, leading to symptoms such as nausea, vomiting, diarrhea, or constipation. Diabetes can also cause erectile dysfunction in men by damaging the blood vessels in the genital area. Effect of diabetes on bone health. High blood sugar levels prevent bone-forming cells from creating healthy bone tissue. Some oral diabetes medications can also cause bone loss as a side effect. Kidney damage in diabetes may result in the loss of calcium needed for strong bones. Ultimately, the effect of diabetes on bone health can lead to osteoporosis. Effect of diabetes on depression. Although the relationship between diabetes and depression is not fully understood, the challenges of managing diabetes can be stressful and lead to depressive symptoms. Diabetes can cause health complications that may worsen symptoms of depression. Depression can lead to poor lifestyle choices, such as unhealthy eating, reduced physical activity, smoking, and weight gain, all of which are risk factors for diabetes and can exacerbate the condition. Depression affects your ability to perform tasks, communicate, and think clearly, which can interfere with successfully managing diabetes. In fact, the relationship between diabetes and depression is bidirectional. Diabetes can lead to depression, and people with depression are more likely to develop diabetes. Effect of diabetes on the fetus. During pregnancy, the mother's condition directly affects the fetus's health. Macrosomia, or an excessively large fetus, is the most significant effect of diabetes on the fetus, leading to complications during both pregnancy and delivery. Uncontrolled maternal diabetes during pregnancy can also result in developmental disorders and various congenital anomalies in the fetus. Thank you for watching. If you found this information helpful, please like this video and subscribe to our channel for more health-related content.